is looking at equipment that we need to use within the inpatient units. When we first moved here, we had a lot of new equipment, so things are beginning to show signs of wear now, and we obviously have to meet all the criteria for infection control, so making sure the piece of equipment is suitable for the patient use, but also that it can be cleaned and maintained within our local guidelines. The chairs were all new at the same time as the hospital. There were some that we had recovered and revarnished at the same time, but generally 3/4 of them approximately were showing wear and tear on the arms. Some of the varnish, the wood was showing signs of scrapes, and the stains on the fabric we weren't able to clean off anymore, so obviously it didn't look very nice, and the infection control team brought it up as part of their audit, and we knew we'd have to look at what we would need. And also some of the chairs didn't fit the requirements of our patient group. We ideally needed more for bariatric patients and perhaps for taller patients, so we needed to have more of a variety of sizes and heights. And we also needed to make sure that the pressure relieving cushion was as good as it could be, because that has become more of a priority. We had worked with AJ before. They had previously provided our chairs, but I was very keen to make sure that we had a look at what was on the market, what had changed, and were there things that were better than we'd had before. And this was good because we could also invite the physios, the occupational therapists, members of staff, so they could all have a look at the equipment that we were thinking of purchasing. So everybody was able to have an input into that, and especially the physiotherapists we thought were important. We ideally wanted one beside each bed in the hospital and some spare ones, because we needed a variety. So you might have a short little lady who'd want a small one that was sort of lowish to the ground, or you might have a very tall male that wanted one that was bigger and wider, and it's really important that they're the right height so they can get in and out of it easily. The other thing we have to consider now is that it's got housekeeper wheels, so did it have the facility for wheels on the back so it can be moved easily? You're not asking staff to lift them, which is a manual handling issue. We had one or two that we wanted drop arms with, not a great deal of those, but it's always useful, especially on the rehabilitation ward for the stroke patients, if they've got to do slide transfers, to have that drop side. We definitely need an increase in the bariatric ones that would take the heavier weight. Also that they would take the elephant feet, so that we had the option of even more variety of lifting them up and raising the height, because the chances are you've never got the right size when you want it, so the more flexibility you could have, the better. We were looking at 20 chairs for each unit and additional recliner chairs as well. These are riser recliners, so it gives the patient the independence to be able to move themselves as they want to reposition, and also that they can sleep in them if necessary. Patients that are extremely breathless often feel very unsafe and more breathless in a bed that they gradually slip down in, whereas the recliner chair gives them the option of changing their position, and they can be more upright and they feel more secure. They had again to be washable to meet the criteria for cleaning with a mild bleach solution. They also had to have locks on the wheels, but because they are quite a heavy chair, that we could move them fairly easily as well. And in the ones that we've chosen from AJ was the additional advantage of being able to put a pressure relieving cushion that sits down into the seating area. So if you wanted a specific cushion, if you put it on top of what they're sitting on, it changes their position, and it's not so good for them anatomically. So these have the advantage of being able to sit down into the space, the cushion space, so we could change it if necessary. And the riser recliner bit, obviously, that it helps them to stand up as well. So that helps the patient feel more independent, but it also helps the nurses tremendously. The cushions that we're planning for all the chairs, we're looking at the IntelliGel, but the advantages of the chairs we've chosen is that all the cushions are removable, so we could replace it with a electric air cushion if necessary, or a roho if we felt that was more appropriate for any particular patient, is the flexibility. The fabric we've chosen, again, is very stretchable, because if you have a fabric that's not got any stretch in it, when you sit on it, however good your cushion is, the fabric won't stretch to fit the cushion. So the one we've gone for, well, the colour scheme will fit in with the rest of the hospital, because it's important, it looks nice. And again, it's washable with this weak bleach solution that we need. All the cushion covers will be zipped to come off, so they can go in the washing machine, and the rest of the chair has got the minimal number of grooves, so crumbs aren't collecting in it. We've deliberately chosen open arms, so that nothing sort of sits in the side, tissues and food crumbs and things like that. We've kept the wings at the top of the chair because we feel that's important. Some of the elderly just like to snooze in their chair, and it's important their head feels secure and supported in that way. And we've got all padded arms, because it's very difficult if you've got people with fragile skin. They easily abrade them if they've got wooden or metal arms. And the advantage of these chairs is that the arm pieces are removable, and they tend to wear quite quickly. So if they were worn, we could just replace the arms. So it's about looking at short-term and long-term needs. It's really important that the chair is comfortable for the patient. It's the right size, it's the right height, because they do spend quite a bit of time sat in it during the day. And it's got to look nice as well. You don't want it to look like a clinical chair. You want it to look like something that's appealing to sit in. At the moment, as I expect as in every other hospital is doing, infection control and pressure area care is sort of top of the agenda. So it's really important that we meet those criteria. And obviously if we've got the right equipment, then that's less risk to the patients developing pressure sores. If they're sitting correctly, you've got padding where their bony prominences come on the elbows and the arms, then hopefully we can reduce the number of pressure ulcers that we're seeing. We've always found AJ Waite's very good follow-up. The last time when we had a problem, it was followed up, and with that sort of confidence, it is nice to know who you're dealing with, and the confidence to be able to that if you have got a problem, it will be followed up properly in the correct way, and that things have been checked with me since the order has gone through as well, to make sure it's as good as it can be, and that they understood the specification that I wanted, and that was being fulfilled. And I remember that feeling when I ordered the last ones, that when they arrived, and is the colour right, and will they fit in, and will they be all right? Because it's quite a big, it's a large amount of money that we're talking about, and especially when it's charity funded, I've got the responsibility of making sure the equipment's right, but you're also spending other people's money, so it's important that it's as good as it can be.